Hello everyone, in this video I will explain about H2 blockers. So it is one of the important groups of drugs used to reduce gastric acid secretions. So before learning these drugs, let us first understand how acid is normally produced in the stomach. So when food enters the stomach, the different substances stimulate acid secretions. One of the most important stimulator is histamine, which is released from enterochromaffin-like cells. So histamine binds to H2 receptors present on the parietal cells. This activates the proton pump, also known as the hydrogen potassium ATPase, resulting in the secretion of hydrochloric acid in the stomach. So why do we need H2 blockers? Normally, acid helps in digestion, but when too much acid is produced, it can damage the stomach lining and cause disease such as peptic ulcers and gastroesophageal reflux disease. So, to reduce excessive acid secretion, we use H2 receptors blocker. H2 receptor blockers are drugs that competitively block histamine H2 receptors on gastric parietal cells, thereby reducing gastric acid secretions. X mechanism of action. So when an H2 blocker is administered, it binds to the H2 receptors and prevents histamine from attaching. As a result, intracellular CAMP levels decreases. Since CAMP is reduced, activation of the proton pump decreases. So finally, hydrochloric acid secretion is reduced. Classification. H2 blockers are classified into first generation, second generation, and third generation. First generation drugs are cimetidine, second generation ranitidine, third generation famotidine, and isotidine. So cimetidine is the first H2 blocker. It competitively blocks H2 receptors and also it inhibits CYP450 enzymes. It causes drug interactions and it may produce gynecomastia and impotence with prolonged use. Ranitidine is the most potent than cimetidine and it has less CYP450 inhibition. And it is the most common drug used for gastric acid secretions. Next, famotidine is a more potent drug, it has longer durations and it has minimal CYP450 inhibition. Side effects are very few and commonly preferred drugs in the hospitals. Nisatidine is similar to famotidine and good for oral absorption and it less used today. Next, therapeutic uses. It used to peptic ulcer disease, gastric ulcer, duodenal ulcer, gastroesophageal reflux disease, Zollinger-Ellison syndrome, and also stress ulcer prophylaxis in selected hospitalized patients. The common adverse effects are headache, dizziness, diarrhea, and constipation. Cimetidine specific side effects are gynecomastia, impotence, confusions, and CYP450 inhibitions. And these should not be used for several renal impairment patients, elderly patients, and patients taking multiple medications or should be avoid the H2 blockers. So H2 receptor blockers reduce gastric acid secretion by blocking histamine H2 receptors on parietal cells. This decreases CMP, reduces proton pump activation and lowers acid secretion. They are mainly used in peptic ulcer disease and GERD. Among them, famotidine is commonly preferred because it has fewer drug interactions with the cimetidine. So thank you.